My son's name is Camlin Byer, and he is 2.5, and he was diagnosed with Kabuki Syndrome at age 13 months. Cam was born 4 weeks early, and he had a few issues from the get-go, but mostly with feeding. And all the doctors that we saw said that, oh, it's because he's 4 weeks early, he'll catch up. And as the months went on, we didn't see the progress that we were expecting. So finally, he was hospitalized at 7 months old, and we saw multiple specialists, neurology, genetics, the gastroenterologist when he got his feeding tube, and we finally learned that he had Kabuki Syndrome. I was glad that we had an answer quickly. I was overwhelmed. I can't say that I was happy to hear it, but I was thankful to know that we had an answer, and we had different guidelines that we could look toward to see maybe how he would develop, what his life might be like. Everyone with Kabuki Syndrome presents differently, so no two kids are alike. Cam is developmentally delayed for his age, although he's making great progress in catching up and just doing things on his own timeline. But at 2.5, kids are typically beginning to potty train, and he's nowhere near that. He doesn't have the fine motor skills to unbutton a shirt or to pull off his pants. Sometimes he grabs the tabs on his diapers, but he can't take his diapers off. In his language, he's pretty good about understanding what you tell him or what you ask him. His expressive language, what he can say, how he can communicate, is definitely behind your typical 2.5-year-old. And another issue with that is his mouth has a hard time pronouncing certain sounds. So his speech is very, very hard to understand. So we're in speech therapy. Cam has had a feeding tube since he was 7 months old. First he had a NG tube, which went through his nose, and then a couple months later he had surgery to get a G tube, which is directly in his abdomen, goes directly into his stomach. We are currently working on transitioning him from eating by the feeding tube to eating with his mouth. One issue with Kabuki Syndrome is that he's had low muscle tone and has had a hard time coordinating his chewing and swallowing. So even though people assume that eating is something that comes naturally, we have to teach him how to do that and give him the skills in order to be able to eat by mouth like everybody else does. Cam is almost like your typical little 2.5-year-old boy. He laughs, he finds things funny, he loves to give hugs, he just has a great, happy personality. If you have a child and you suspect there's an issue happening, keep pushing, keep asking questions, keep going to the doctors. If you don't like the answer that you hear, see another doctor. There are a lot of families out there that see a doctor and they just brush it off. So I would say never stop advocating for your child, never stop asking questions, never stop doing research, never stop reaching out to other parents. You just have to put yourself out there and ask questions, and you'll make some good connections, and you'll finally get some answers. I'm a pretty positive person, and I know that we're only on this planet for a short amount of time, so I could either spend it worrying, wishing something had changed, wishing something was different, or I can take the situation that I'm given and try to make the best of it and keep going. Some assumptions about special needs children would be that you really have to treat them differently. And Cam, in ways, a very typical 2.5-year-old. He wants to interact, he wants to play. So he might not play the same way that another 2-year-old would play. He really is no different in his basic desire to be talked to and played with and cuddled and hugged and loved. If I meet someone that is not used to being around a special needs child, I would say ask questions if you have them, interact just like you would with another child. If it seems like they're having a hard time understanding, you could ask the parent what's the best way to play with him or the best way to talk to him. And I think you'll find that most parents are happy to talk about their kid, happy to tell you what makes them different, what they like, what makes them special. So you just have to keep the communication open and ask questions, and definitely don't ignore it. It's like addressing the elephant in the room. If you think there's something different, find a polite way to ask a question. I think as a special needs parent, your main concern is that your child is included. So I am hoping that by spreading awareness for Kabuki Syndrome and any other rare genetic disorder, it's just that include our children and ask questions about their differences, but don't pretend that they're not there.